All right, so today we're going to be doing a deep dive on burn cases.
Oh, cool.
Yeah.
I love this stuff.
Yeah, and this is I was looking over the trauma guide that you gave me, and
Oh,
this section is really intense.
yeah.
Like, I'm not.
It's pretty heavy stuff.
Yeah.
Yeah. So,
Sticks with you.
yeah.
For sure.
And I think what I really want to kind of focus on today is like not just listing the facts about burns,
Right.
but really trying to get into like the decision-making
Yeah.
process for treating them,
Absolutely.
because I think that's where it gets really interesting.
Yeah, you really have to understand the whole picture, right? You have to understand the type of burn, the severity, the patient's medical history.
Yeah.
All of that goes into how you treat the burn.
Yeah, and how like all those different things interrelate too.
Exactly.
And how like maybe one, aspect of their medical history might
Right.
influence how you would treat a certain type of burn.
100%. Yeah.
Yeah. So, and we've got some crazy cases here.
Yeah.
Oh, yeah.
Like we've got, kid in a house fire. We've got a guy who falls into a bonfire.
Oh, wow.
Yeah. And I think even a workplace accident with some pretty nasty chemicals.
It's amazing how each one is so different,
Yeah.
and it's never the same.
So let's just jump right into the first case.
Okay.
So this one is the 10-year-old girl in the house fire.
Oh, geez.
So picture this, right? It's late at night.
Oh, okay.
House is on fire. Firefighters pull this girl out of a closet.
Oh, no.
She's got soot around her mouth and nose.
Right away, that's a big red flag.
Right.
Soot means she's probably inhaled a lot of smoke.
Yeah. And she's having trouble breathing.
Right. That's a huge concern because smoke inhalation can be deadly.
Yeah.
Plus, if there are burns on her face and neck, her airway could be closing up.
And she has second-degree burns on her face and neck.
Oh, man.
Yeah. So things aren't looking good.
No, they aren't.
And then they find out she has a history of asthma and epilepsy.
Oh, wow.
And she's on medication.
Okay, so now we're adding another layer to the puzzle.
Right. Like, how does that change things?
Well, for starters, asthma means her lungs are already sensitive, so that smoke inhalation could hit her even harder.
I see.
And the medications, you always have to know what a patient is taking because some drugs can interact with burn treatments.
Oh, that makes sense.
You don't want to accidentally make things worse.
So right away, they start treatment.
Good.
They get her oxygen. They're monitoring her vitals very closely.
Of course.
And then they use this thing called the rule of nines
Oh, yeah.
to figure out how much of her body's burned.
Yeah, the rule of nines, it's a fast way to estimate the percentage of body surface area with burns.
Okay.
Basically, they divide the body into sections that represent 9% or multiples of 9.
And how does that work in this case?
So they determine she has second-degree burns on her entire chest, abdomen, and both arms,
Okay.
which totals up to about 19.5% of her body's surface area.
19.5%. So that's pretty severe.
Definitely, especially for a child.
Right, because kids are more delicate, right?
Yeah, they have thinner skin and a larger body surface area compared to their weight.
I see.
So burns can affect them more seriously.
Right.
More vulnerable to fluid loss, temperature regulation problems, infections, you name it.
Oh, wow. Okay.
Yeah.
So, and then to make matters worse, she has a seizure while they're rushing her to the hospital.
Yeah. No.
And remember, she has epilepsy.
Right.
Right.
This is intense.
A seizure on top of everything else is a major concern. It could be from lack of oxygen to the brain, a complication from her epilepsy, or even a reaction to medication.
Gosh, so they had a lot to figure out.
They do, and fast.
All right, so that one was a lot.
Yeah, it was.
Let's move on to case number 2.
Okay,
This one is, well, it's pretty dramatic.
let's hear it.
This guy falls into a bonfire.
Oh my gosh.
Yeah. And to make matters worse, he was intoxicated.
Oh no.
Yeah. When they found him, he was confused, strong smell of alcohol on his breath.
Okay, so right away, the alcohol intoxication complicates things.
Well, first of all, impaired judgment probably played a role in him falling into the fire.
Makes sense.
But alcohol also affects pain perception, so it can be hard to tell how badly he's actually injured.
I see.
Plus, alcohol interacts with a lot of medications, so that's another thing to consider.
Right, right.
Yeah.
And he's burns all over face, arms, chest, stomach.
Oh, that's terrible.
Yeah, really bad.
Wow.
But there's this detail in the notes about his rings.
His rings.
Yeah, like they were really focused on getting those off his fingers.
Oh, I see.
Why is that such a big deal?
Well, think about it. Burns cause massive swelling, right?
Right.
So those rings could basically become tourniquets cutting off blood flow to his fingers.
Oh, wow. I didn't think of that.
Yeah, and with burns, you're always racing against the clock, trying to prevent further damage.
Makes sense.
So getting that jewelry off, especially rings, is absolutely crucial.
Wow. So every little detail matters.
It really does.
Yeah.
In burn care, every second counts. It's incredible, isn't it?
It makes you wonder how they even get them off, right?
With all the swelling.
Oh, yeah. It can be tricky. Sometimes they have these special tools,
I bet.
but you got to get it done fast.
Yeah, to save those fingers.
Exactly.
So it turns out this guy, he's not just dealing with the burns.
Uh-oh. What else is going on?
He's got a history of alcohol dependence,
Oh, wow.
and he's taking this medication, antabuse. Antabuse. Okay, that's disulfiram,
Yeah.
and that causes some serious problems when mixed with alcohol.
Like what kind of problems?
We're talking intense nausea, vomiting, even heart problems.
So how does that affect his burn treatment?
It makes everything more complicated.
Like what specifically?
Well, for one thing, pain management.
Oh.
You have to be really careful with what medications you give him.
Right, because of the interaction with the antabuse.
Exactly.
And then there's the fluid resuscitation.
That's another big one.
Wait, what is fluid resuscitation?
Ours. It's basically giving the patient IV fluids to replace what they've lost because of the burns,
Because they get dehydrated.
right? Severe burns make your skin lose its ability to hold fluid.
So they need extra fluids.
Exactly. It helps maintain blood pressure, prevents shock, supports organ function.
But with this guy,
You have to be super cautious because giving him too much fluid could overload his system.
especially with the alcohol and the antabuse,
Right. It's a delicate balance.
it's like walking a tightrope.
It is.
Mm.
You have to consider all these different factors and how they interact.
It really shows how important that medical history is.
It's crucial, even when the patient isn't fully coherent. You never know what kind of hidden dangers might be there.
That's a good point. Okay, so are you ready for something completely different?
Yeah, bring it on.
Okay, this next case takes us out of the ER and into the workplace.
Interesting.
This guy, Hunter, he's working with this chemical phenol.
Um,
Yeah, and he spills it on himself.
Oh no, that's bad news.
Before we get into the details, can you explain what phenol is and why it's so dangerous?
Sure, phenol is this corrosive acid that's used in a lot of industrial processes. It can cause some serious burns on contact.
Like, how serious are we talking?
We're talking deep tissue damage.
Yikes.
It can even get into your body and cause even more problems.
So what do you do if you spill it on yourself?
Well, the first thing is to act fast.
Okay.
Time is of the essence.
Right.
Luckily, this guy, Hunter, he was thinking quickly and used isopropyl alcohol to decontaminate the area.
Isopropyl alcohol.
Yeah, it can actually neutralize phenol to some extent.
Oh, wow. I didn't know that.
But the key is to keep flushing the area with tons of water.
Water.
Yeah, to remove any remaining chemical.
Okay, so lots of water.
Lots and lots of water.
And what about clothing?
Oh yeah, gotta get those contaminated clothes off immediately.
Right, so the first responders did that right away.
Good, they kept flushing his burns with water.
You said that's essential for chemical burns.
It is.
It's interesting how the type of burn dictates the initial treatment.
Absolutely. Knowing what specific chemical is involved is vital.
So they were able to stabilize Hunter, and thankfully, his vitals remain stable.
That's good news.
But he's definitely going to need ongoing pain management
Of course.
and close monitoring for potential complications.
Absolutely.
What are some of the long-term effects someone might face after a chemical burn?
Oh, there could be a lot. Scarring contractures.
Contraction.
That's where the skin tightens and restricts movement.
Oh, wow.
And even functional impairment, depending on where the burn is and how bad it is.
So Hunter might need skin grafts, physical therapy,
Possibly.
and ongoing medical care.
It's a long road to recovery.
It's a good reminder that the impact of a burn goes way beyond just the initial injury.
Absolutely. There's a whole lot to think about.
Okay, so we've covered 3 very different cases, each with its own unique challenges and critical decisions.
It's been quite a journey.
It has. What are some of the key takeaways you hope our listener is walking away with?
Well, I think these cases really highlight how complex and individualized burn treatment is.
No one-size-fits-all approach.
Exactly. We saw how factors like age, pre-existing conditions, the circumstances of the burn, even something as simple as wearing a ring,
Right.
it can all have a huge impact on how you manage the case.
It's like each case is a puzzle with all these interconnected pieces.
I like that analogy.
And getting it right requires not just the textbook knowledge, but also,
Thinking on your feet.
yeah, and understanding how the body responds to trauma.
Exactly.
Yeah.
It's about seeing those connections, recognizing patterns, making informed decisions that can really make a difference.
It's pretty incredible stuff.
Yeah.
Yeah, it really is amazing stuff. Makes you appreciate the people who do this every day.
Oh, yeah, for sure.
So for our listener out there who, might not be a doctor or a nurse or anything,
Right.
what can they take away from all of this? Like, even if we're not, facing these exact situations,
Hmm, that's a great question.
are there any takeaways, for just everyday life?
Yeah, definitely.
Okay.
Like, I think everyone should know basic first aid for minor burns at least.
Okay, like what kind of stuff?
Well, the classic example is running cool water over the burn.
Oh, yeah, right.
That can really help minimize the damage.
Okay, so cool water, not ice water.
Right, exactly. Cool water for like 10 to 15 minutes.
Okay, good to know.
Yeah. And of course, being aware of potential fire hazards in your home and workplace.
Right, prevention is key.
Always.
It's like we focus so much on the treatment, but really preventing these things from happening in the first place is so important.
You're absolutely right.
And it's not just physical safety either, right?
No, right.
Like these cases, they also kind of remind us about mental health and well-being.
Yeah, absolutely.
Like we saw how alcohol abuse played a role in one of the cases.
Right. That highlights the need for support and resources for people struggling with addiction.
For sure. And the emotional trauma that burn victims experience.
Oh, yeah, that's huge.
Can't forget about that.
It's a long road to recovery, both physically and mentally.
So it's like healthcare goes beyond just treating the physical injuries. It's about the whole person, right?
It's about the whole person, their mental and emotional needs, too.
Yeah. I think that's a really important takeaway from all of this.
Me too.
Whether you're a medical professional or just someone trying to live a healthier life,
Right.
Understanding that connection between our physical and mental well-being.
It's crucial.
It is. Yeah. Wow. Well, I don't know about you, but I am definitely walking away from this deep dive
Yeah.
with a whole new appreciation for
Same here.
the complexity of burn care
It's amazing.
and just the resilience of the human body.
The human body can endure so much.
It really can. And for our listener out there, we hope this has, piqued your interest.
Yeah.
Maybe inspired you to learn a little bit more.
For sure.
There's always more to learn.
Absolutely.
And who knows, maybe you'll uncover something that we didn't even talk about today.
That's the beauty of learning.
It is. Thanks for joining us on this deep dive.
It was my pleasure.